Hello, my name is Crystal Reyes, and today I'll be going over the accreditation plan for Wayne County Public Health Department located in Michigan. My partners are Jill Decker and Jennifer Mwami. This presentation includes demographics, the mission and vision, current progress, area of focus, the balanced scorecard, goals and measures, proposal, intervention strategy, and questions and discussions. Wayne County has 16 government health and human service facilities. They serve 1,749,366 people. There are 2,848 people per square mile in the area. Wayne County is the most populated county in Michigan and the 19th most populated in the U.S. 52% of the population of Wayne County are female, with an average of 48% are male. There are 52.8% that identify as white, 38.9% of the population identify as African American, and 3.1% of that population identify as Asian. 4.4% of the population have completed less than the 9th grade, 29.9% have a high school diploma, with 13.7% having a bachelor's and 9.3% having a graduate degree or higher. 41% have never been married and 38% of the population are married. The median household income is $43,464, with the per capita income being $25,269. 60.4% of the housing are owner occupied, whereas 39.6% of the population are renter occupied. The mission statement of the Wayne County Health Department was established to coordinate and administer health, education, youth, veteran, senior, and social services to residents and communities in Wayne County in order to address the social determinants of health and community wellness. The vision is to reduce and ultimately eliminate disparities and inequalities related to social and environmental justice by focusing on financial, education, healthy living, and healthy neighborhoods. According to the Wayne County Public Health Department's medical director, the county is in the very early stages of the national accreditation process. The county has completed a cost-benefit analysis, and at this time, they've decided not to move forward with the accreditation process due to the cost. We have identified 5 focus areas that need to be addressed in order to make Wayne County the healthiest county in the state. The first is funding. Funding is essential for attaining national accreditation, as well as establishing much-needed programming throughout the county. To address this issue, we suggest county health departments look into both state and federal grants available through the CDC, as well as from the Robert Wood Johnson Foundation, in order to support national accreditation. Second, there is a high incidence of poverty within the county. According to the Wayne Metropolitan Community Action Agency, CHNA, 24.8% of the population of Wayne County lives in poverty. This number equates to approximately 440,000 individuals. Furthermore, based on this study, 2 key cities have the highest poverty rate in the county, specifically Hamtramck, with a poverty rate of 48.5, and Highland Park with a poverty rate of 47.5. Finally, when applying the federal poverty level to the county, we begin to see that 11% of the population lives between 100 and 150% of the poverty level, and 9% live between 150 and 200% of the federal poverty level. To measure and track the poverty level within the county, health officials could look at the Wayne County Health Assessment and SES indicators, such as education, unemployment rates, and free and reduced lunch programs. The third focus area we identified is obesity. According to the health department data on Wayne County, the obesity rate in Wayne County is 5% higher than the national average. The male obesity rate is 38.1%, which has risen by 19.9% from 2001 to 2011. The female obesity rate is 44.5%, which has also risen by 15.4% between 2001 and 2011. The data suggests that individuals over the age of 45 have the highest incidence of obesity. The target measures that indicate obesity include BMI assessments taken during medical visits, diabetes rates, heart disease related to obesity, mortality related to obesity, and assessing the primary and secondary costs associated with obesity. The fourth area of focus identifies as housing. Over the past 15 years, the number of available houses has dropped from 48,000 to 24,500. According to the Michigan State Homeless Management Information System, there are approximately 26,000 homeless individuals in Detroit and the greater Wayne County area. To assess the impact of housing shortages, health officials should take a look at rates related to homelessness, such as usage of shelters, food banks, and various housing agencies located within the county. The fifth and final focus area we identified is hunger and food insecurity. Wayne County is ranked 36th in the nation for counties with food insecurities. In 2014, it was estimated that 20% of the total population had food insecurity, while approximately 23% of the children within the county experienced it directly. When we consider the widespread use of free and reduced price lunches, we learned 59.4% of students in the county meet these requirements, which is 13% higher than the state average. To measure food insecurities, public health officials should look at the usage rates related to food stamps, free and reduced lunch programs, SNAP membership, food banks, and other agencies. To identify goals and measures needed to address the previous focus area, we use the Balanced Scorecard software. The software was created in 1992 by Robert Kaplan and David Norton. It is used today to track both performance and management efforts within businesses. After studying successful business, the founders identified 4 key aspects to a successful business, which include customer financial, business processes, learning, and growth. Goals and measures. How do Wayne County residents see the Public Health Department? Goals for the customer service perspective would be for the county to complete a needs assessment and ensure that the residents of Wayne County have a voice in determining the areas of concern. Measures will address the perceptions, attitudes, and outcomes. The financial perspective addresses how does Wayne County obtain funding and who to go for funding. The goals will be to procure funding for the accreditation process as well as the additional administrative costs. The measures would include long-term sustainability, seeing the process through until the end, and benefit versus risk. Measures would include time and input resources, and grants and proposals. From the business perspective, what must Wayne County do to increase the health of the population? The goal will be to increase cross-sector collaboration with city, state, and local organizations that can potentially contribute to accreditation funding. Measures would be time and input resource compared to grants, proposal requests, and partnership outputs. Finally, the learning and growth perspective is how can we continue to develop and improve the public health office in new and innovative ways. The goal will be to create a needs assessment, improve cross-sectional collaboration, and increase access to funding sources. Some measures would include employee productivity, cross-training, cross-functional assignments, and health promotion programming. In this slide, we have filled in the balanced scorecard, which includes the previous focus areas mentioned, as well as places an emphasis on a cross-collaborative effort which is needed for national accreditation. Although we don't have time to discuss all of the specifics right now, we will make this PowerPoint available so that you can review it at a later date. This is merely a tailored example to provide you with some ideas related to the focus areas that we've provided. For our proposal today, we have 6 recommendations. First, we recommend that the Wayne County Public Health Department complete a CHA, a CHIP, and strategic plan, which are required for national accreditation. We suggest public health officials reach out to local hospitals or health agencies in the area who've already completed one and obtain knowledge and recommendations on how to conduct their own assessments. Next, we recommend the Public Health Department work in collaboration with the community, education, businesses, hospitals, and government agencies to develop a chip. During these meetings, the group can work together to identify and prioritize common goals, resolutions, and a means of following up on developed programs. Finally, we also suggest the Health Department create a strategic plan in collaboration with government officials and the community. Next, we recommend that the Wayne County Public Health Department work in collaboration with local hospitals. The CDC claims that hospital CHNA is similar to the CHA, so health offices that seek out local hospitals with the CHNA can benefit greatly from the knowledge. According to our research, in 2016, 3 hospitals, Beaumont, Botsford, and Oakwood, collaborated to develop a CHNA. It is important that the county health department link up with these local hospitals to gain further insight into current health disparities within the county and the health disparities of the greatest importance to individuals. Our third recommendation is the development of an interagency collaboration. These are essential to ensuring that everyone is aware of health disparities and working toward eliminating them. By working with individuals from communities, schools, health sectors, and professionals, the Public Health Department can ensure a unified front is created where everyone is working together to obtain common goals. One effective example that has been used in Detroit to bring individuals from various sectors within a community was the UN Sustainable Development Goals format. We recommend that the County Health Department use this framework when developing their CHIP and strategic plan to help bring communities together and to identify common goals and measures. According to the Wayne County Health Department's medical director, there is no current plan to pursue national accreditation. However, since 1999, the states enacted the Public Health Code Policy 8000, which requires that states be responsible in ensuring that local health departments be accredited by the state. According to the Michigan law, the state health department is charged with ensuring that each local health department meet the requirements of the Public Health Code. The state health department has included staff from the Department of Health and Human Services, Department of Agriculture, Department of Environmental Quality, and the Department of Education to provide support to local health departments in an effort to ensure that all areas of public health are being addressed. Research has shown that there is a benefit for students, communities, and local health departments to collaborate through academic partnerships. The use of public health students provides training for the students, but also increases the workforce and capacity of the local health department's accreditation. With Wayne County's robust academic education infrastructure, there will be multiple opportunities to include students and facilities from the schools of nursing, public health, health administration, social work, and fields that include information technology systems. The presentation will depict our recommendations to the Wayne County Health Department. Our suggestions include hospital collaboration, interagency collaboration, staff accreditation, and additional support. Once the presentation is approved by the Wayne County Health Department, the Accreditation Plan Committee and Volunteer Support Group can utilize tools developed by the state and begin working toward obtaining a full-time accreditation coordinator and completing and developing the CHIP, the CHA, and the strategic plan. Streamlining goals and adding human resources should result in PFAB accreditation by 2021. That concludes our presentation on the Wayne County Health Department Accreditation Plan. We suggest that if there are any additional questions or concerns, that the Wayne County Health Department contact PFAB for additional information and guidance on obtaining the national accreditation. Thank you for your time.